One of the easiest questions you can ask your sleep patients to get them to move forward with whatever next step there is in your workflow or in getting the treatment they need is the question, would you agree? Let's say you have a patient in the dental chair and they have never had a sleep test. You do your preliminary screening and doctor comes in and says, you display 5 of the 8 indicators of being at risk for obstructive sleep apnea. Would you agree that breathing is important? Lighthearted question gets a chuckle from the patient. Yeah, I think breathing is important. Would you agree, like based on our findings, that it would be important for us to learn whether you have this disease so that we can actually address it? Yes, I want to do that. Great, we're going to order up a sleep test. Or that sleep test comes back and you say, Nancy, you stop breathing 22 times an hour. Would you agree that that's not good? Nancy's like, yeah, that doesn't sound good. You're absolutely right. So here's our options. Ask that question, would you agree? That causes the patient to own the problem and make the decision rather than feeling like you've made the decision for them.